Antimicrobial resistance, AMR, occurs when microorganisms such as bacteria, viruses, fungi, and parasites evolve to withstand the drugs designed to kill them. This resistance renders standard treatments ineffective, leading to persistent infections and increasing the risk of spread to others. AMR is a growing global health crisis, demanding urgent attention and comprehensive strategies for mitigation. Without immediate action, the problem will escalate, leading to widespread and untreatable infections that could severely impact global health and economies. The causes of AMR include the overuse and misuse of antibiotics, inadequate infection control, lack of new antibiotics, and environmental factors. Excessive and inappropriate antibiotic use in human and veterinary medicine accelerates resistance. This includes using antibiotics for viral infections, failing to complete prescribed courses, and using antibiotics as growth promoters in livestock. Poor hygiene and infection control in healthcare settings contribute to the rapid spread of resistant bacteria. The pharmaceutical pipeline for new antibiotics has slowed, limiting treatment options against resistant strains. Antibiotics released into the environment through pharmaceutical waste, agricultural runoff, and improper disposal promote the spread of resistance. Additionally, global travel and trade increase the transmission of resistant pathogens, making AMR an international issue requiring a unified global response. The damages caused by AMR are severe and widespread. In terms of health impacts, resistant infections lead to higher mortality rates due to limited treatment options. Patients with AMR infections require longer treatment durations and hospital stays. As resistance grows, available antibiotics become less effective, leaving fewer alternatives. The economic consequences include higher healthcare costs, as resistant infections require more expensive drugs, intensive care, and extended hospitalization. Illness and death from AMR-related infections significantly reduce workforce productivity and economic growth. The impact on medical advances is substantial, as chemotherapy, organ transplants, and surgeries depend on effective antibiotics to prevent and treat infections. AMR compromises these essential treatments. Furthermore, resistant bacteria spread internationally through travel, trade, and migration, making AMR a critical public health issue. The continued emergence of resistance threatens not just individual health but the broader sustainability of modern healthcare systems, creating a vicious cycle of increased illness and financial burden. To combat AMR, various strategies must be implemented. Strengthening antibiotic stewardship is essential. This includes regulating antibiotic use by enforcing stricter regulations on antibiotic prescriptions in both human and veterinary medicine to minimize misuse. Promoting responsible use through education of healthcare professionals and the public on the importance of appropriate antibiotic use is critical. Banning the non-therapeutic use of antibiotics as growth promoters in livestock can help curb resistance development. Enhancing infection prevention and control is another key measure. Improving hygiene and sanitation by strengthening hygiene practices in hospitals, farms, and communities reduces infection spread. Implementing vaccination programs decreases the need for antibiotics by preventing bacterial infections in humans and animals. Strengthening surveillance systems to track and monitor resistant infections at local, national, and global levels facilitates early intervention. Additionally, improving diagnostic methods ensures accurate identification of infections, reducing the unnecessary prescription of broad-spectrum antibiotics. Boosting research and development is crucial to addressing AMR. Developing new antibiotics through investment in novel drugs and alternative therapies such as bacteriophages and antimicrobial peptides is necessary. Exploring non-antibiotic treatments, including probiotics, immunotherapies, and microbiome restoration strategies, offers promising solutions. Encouraging public-private partnerships allows governments and the private sector to collaborate in funding innovative AMR research. Reducing environmental contamination is also essential. Implementing proper disposal practices for unused antibiotics prevents environmental contamination. Establishing strict guidelines for the disposal of antibiotic residues from pharmaceutical manufacturing ensures responsible waste management. Monitoring agricultural runoff by controlling antibiotic use in agriculture and ensuring proper waste management in livestock farming helps limit resistance spread. Public awareness campaigns and stricter legislation regarding antibiotic disposal could help prevent further environmental contamination, ultimately reducing selective pressure for resistance. Metagenomics is a valuable tool in combating AMR. It involves the study of genetic material recovered directly from environmental or clinical samples. Unlike traditional microbiology, which requires culturing organisms, metagenomics analyzes all DNA present in a sample, providing a comprehensive view of microbial diversity and resistance genes. This approach enables comprehensive detection of resistance genes by identifying those in bacteria that cannot be easily cultured and detecting novel resistance mechanisms, enhancing understanding of resistance evolution. Metagenomics allows monitoring of environmental reservoirs by tracking resistance genes in hospitals, wastewater treatment plants, farms, and natural ecosystems. This helps identify key hotspots for targeted intervention. It also facilitates the analysis of microbial community dynamics by detecting shifts in microbial populations that indicate the rise of resistant strains. Linking antibiotic use patterns with resistance trends aids in policy formulation. Additionally, metagenomics provides crucial insights into microbial interactions, offering potential solutions through microbiome-based therapies and targeted antimicrobial strategies. By mapping transmission pathways, metagenomics uses genomic epidemiology to track the spread of resistance genes across different settings and identify networks of transmission to guide targeted interventions. Supporting public health surveillance and response through early detection of emerging resistance threats allows timely interventions. Metagenomics informs policies on antibiotic use, infection control, and environmental management. It also enhances One Health approaches by integrating data from human, animal, and environmental sources to understand resistance movement and facilitate coordinated global efforts to tackle AMR comprehensively. The ability to predict resistance patterns through metagenomic data analysis further supports the development of more effective treatment strategies tailored to combat evolving threats. Antimicrobial resistance is a major global challenge with severe health, economic, and security implications. Addressing AMR requires a multifaceted approach, including improved antibiotic stewardship, strengthened infection control, enhanced research and development, and environmental management. Metagenomics offers a powerful tool for tracking resistance genes and guiding targeted interventions. By implementing these strategies, the impact of AMR can be mitigated, safeguarding the effectiveness of life-saving antibiotics for future generations. Thank you for watching this video.